Welcome everybody. So nice to be in this space with all of you. Thank you so much for coming. I think I've met all of you. I'm Jennifer Flemington, CEO of Actua, and we're really excited to be doing an event face-to-face. We're super happy to have an amazing discussion ahead of us with the panelists. Minister Bennett is running a little late. There are votes in the House, so she should be here whenever. She should be here in a few minutes, but who knows?
10 minutes.
Caught up. So we're going to get started. I want to, as always, we get to work in this beautiful space every day. I'm so happy to share it with you, but also acknowledge that we're on the traditional unceded territory of the Algonquin Anishinaabe people. And for us, it's just such a joy to welcome you back. I think it's we thought a lot about how to have the right tone for this event because, of course, it's a very serious topic. It's a topic that's deeply personal to many of us, and that's important to acknowledge. And I'm thrilled that you're here and able to have this open discussion. But we're also so happy to just be able to reconnect with you in person. For all of us, and we know it's mental health week this week, and the last 2 years have probably been the most challenging for us. Personally, professionally, with all that we have been dealing with, I don't even like to say that I read the words in here, but I hate saying it out loud, but school closures, yeah. So hybrid work environments, we're at Actua very lucky that we're sort of mostly back, less hybrid, but all of the things, and just missing family and friends and missing the opportunity for us to do these kinds of events. So it's been super tough, and at Actua we're focused on youth, and we know that youth have been the most impacted by the pandemic, and that has been a focus of ours, of course, as an organization that cares deeply about youth. What we know is that there are studies now coming out that are really documenting and formalizing the fact that there's been a very significant negative impact on youth academically and socially. Those of us who have kids, I mean, we all either have kids or care about kids or are educators in some way, and we have seen it firsthand, the impact that this has had on the confidence of those kids, on their willingness and love of learning and their motivation, all of those things that we've seen sort of take multiple steps back, and the research is now coming out to sort of say, yes, what you're feeling is actually, we're validating that it's tremendously negative, and that is only exacerbated for youth who are facing other inequities. So we care, as everyone in this room cares deeply about youth that are facing other barriers, but that the pandemic impacts have been significant for them. So needless to say, there's been a dramatic increase in mental health issues across the board, and it's that is a very doom and gloom message. It's a very serious message, but Actua is big on solving problems and coming up with solutions and taking action. And for us, we care deeply about kids across the country, and as an organization that's engaging hundreds of thousands of kids, we have been thinking a lot about what our responsibility is and what our role is in the next few years, where kids are going to need a massive amount of support and resources to help them build their confidence back in a big way. So we've launched this new campaign. It's called Build Back Confidence, and it's really our way of expressing the fact that we're, as an organization, going to be spending a significant amount of our attention and resources on the mental well-being of youth, and it's within a STEM context, because that's how we do everything. But we also believe that STEM and STEM education are incredibly useful, effective ways at building back that confidence and of getting kids to think more hopefully about their future. So we're launching that campaign. A big part of it is going to be content around science and mental health. We actually are piloting some of that content just next door, and I wish you could all go and see what is happening, because I mean, it's super cute, but it's also incredible because, so they're youth from the Inuit Children's Youth Association, our after school program. They're doing a whole bunch of work around coding. It has an undertone of STEM and coding, but they're also learning about some of the sort of innovative technologies that are being used to manage mental well-being. So that's content that we're then gonna lace through our programs across the country, in addition to really making sure that people are aware of the impact of what this lower levels of confidence in youth is, which is massive and significant and is going to impact all of us economically in the future if we don't kind of turn it around. So what I love about this panel tonight is that we're making sure we understand what the current situation is, but we're also talking about some solutions and some ways to build back some of the capacity of youth moving forward. So I think what we'll do is I'll introduce the minister when she comes in. I'll introduce our other two panelists, and we'll get started, and we'll sort of adjust as things move along. So I will introduce you both before I give you the opportunity to speak. So Dave Murphy is the director of the mental health program at the Children's Hospital of Eastern Ontario, so at Cheo, a place that is special to many of us and certainly one that we're grateful for. He served in this role for the past 4 years. You've also worked for 25 years in acute hospital settings at both Cheo and the Royal, 15 years of which was spent in a clinical setting as a child and youth counselor, inpatient coordinator, and professional practice leader, and then 10 years as the manager of the acute mental health service. So very much on the front lines of the work that has been so critical, and really, really happy to have you here and grateful for what you've been doing over the past, you and your team of 300 people at Cheo have been doing for the past 2 years. Alexandra Lowe is joining us from an organization called jack.org. Some of you might be familiar with Jack. Alexandra will talk a little bit about it. It's an incredible youth-driven, youth-led organization. Alexandra works at jack.org, where she empowers and supports youth in their mental health journey advocacy. Prior to jack.org, she worked in the international development field, focusing on youth and women's health in very precarious environments. At the outset of the pandemic, Alexandra made the decision to change her focus to work with other youth across the country. Mental health advocacy has been an integral part of your life since high school, and she continues to work toward a mental health landscape that is free from barriers while creating a more inclusive and equitable environment, which we all need very much. So we're super happy to have you here. I'm going to start just by asking you both, I just gave a very brief introduction, but tell us, obviously, how you come at this field of mental health and wellness for youth, kind of some of your top level experiences during pandemic, and what your experience has been through your work around confidence in youth. You want to start? Yeah, go ahead.
Sure. So I think everything you've said, Jennifer, is absolutely bang on. Important to know prior to the pandemic that we had seen a year-over-year significant increase in presentations of children, youth with mental health issues, and what the pandemic did was it even furthered that much more in a very significant way. And I think what we've learned is that because this isn't just a Cheo problem, it is a global problem, it is a national problem, it is a local problem. Because we've learned that Cheo can't do it alone, and it really forced our hands to take a look at what it means to actually be partnering more so with our community-based agencies. And when I say partnering, it's really that of increasing our capacity, working with people differently to expand our capacity more globally, and to actually pull in more working relationship with our addictions colleagues. Very much so, mental health is siloed and addictions is siloed, and we need to bring those best together. And I know Minister Bennett will speak much more about that, but we've learned that what we have seen over the pandemic is 3 very significant things. One is a significant increase in suicidal ideation and self-harm. The second is that of a significant significant and unparalleled spike in eating disorders presentations. And the last, I would say, and this isn't just for children and youth, but we work closely with our adult colleagues in the system, is an increase in aggression. And we're still trying to understand that exactly, where that's coming from, but we're seeing that across the board. And what we've learned is that our expansion out to our community providers, but also expansion out to our other local hospitals in which that we partnered up with, and actually doing virtual care emergency room visits to all of our partners within the region, so that kids no longer need to be traveling to Cheo to be assessed and then going back to their home. So Barry's Bay, coming from Barry's Bay just to be discharged to go back, we're now partnering with all to do that virtual check-in and doing assessments in their home community to try and best serve them in their town. And these are all things that we had never even thought about doing before, but the pandemic forced us into doing different things. So out of the pandemic, lots of troubling data and troubling presentations, but at the same time, there's been good opportunities.
Yeah, I think that both of you have kind of taken a lot of the words right out of my mouth, and yeah, I think agree with a lot of what both of you have said. So I come at this from a very different perspective than David would at Cheo, whereas I work more in community development. So my primary job is to really ensure that the youth that I'm working with feel empowered within their own communities to go out and to say, you know, this is the mental health landscape that I'm living in and working in, and something about this really needs to change. So at the end of the day, my job has been accomplished if youth feel more empowered and strong enough to take action in their own communities and to do that advocacy work. And we've learned a lot over the pandemic, and I think a lot of even what we've learned, we kind of knew existed, but it's been really solidified. That statistic of, you know, suicide being the leading cause of death for youth aged 15 to 24, it still exists, and I think that it's becoming more and more pertinent, and I think that people are really starting to take notice of this. And we can even see this in the work that you're doing, right? Like mental health is becoming a topic of conversation in all aspects of our lives. And hopefully this continues, and hopefully that statistic lessens and we can make that change as well. And that's kind of the goal at jack.org. We hope that the youth that we work with as well are able to recognize those behaviors in themselves and be able to seek help and know what to do when they're entering these periods of crisis, so that we can move forward and more on that preventative aspect as well. We've learned that youth are really interested in making policy changes and in fighting for equality, not only in the types of services that they are accessing, but also ensuring that cultural services are easily accessible. And then we also see, you know, with education, youth are fighting back against this academic pressure as well, and how much of an effect that's having on their mental health. Youth are looking at us and saying, like, yes, my education is important and I understand that, but at the same time, this isn't all there is to me, and we need to change this so that we can create a more equitable, inclusive environment and a healthy environment at the end of the day.
That's amazing. And tell just a little bit on that. How has the work that jack.org done? You were working well before pandemic.
Yeah.
How did that shift during pandemic? Like, how did you build that advocacy network? How did the issues change, or were they just exacerbated?
I think a bit of both. When we started long ago, we started at Queen's University. We started right with youth, working with youth.
We started at Queen's.
I was like, that's a great place. Also, as an undergrad from there, yeah, right. It's amazing. Yes, we started right with youth, making sure that we are youth-led and youth-driven. And I think there's something, I don't know what it is, but about this new generation of youth, they are so incredibly outspoken and so just socially aware, and they're able to look at these problems and say, like, something needs to change. So I think from our perspective, that's what we've been trying to do more of. More listening to youth, more listening to what they need and what they want, so that we can be there and not speak for them, but be that platform for them. And I think that's really the goal of our organization. And finding, I think also within the pandemic, we've seen more communities that are more at risk. 2S LGBTQ plus community members have been more affected by the pandemic than any other population. So really making sure that we're reaching out to those particular equity deserving communities and making sure that they also have a platform that's the same as everybody else.
So the Honourable Carolyn Bennett is the current Minister of Mental Health and Addictions. She was first elected in the House of Commons in 1997 and has been elected 8 times as the MP. I know, not for the fan part, as the MP for Toronto St. Paul's. Prior to her election, Minister Bennett was a family physician and professor in the Department of Family and Community Medicine at the University of Toronto. Her entry into politics came with the fight to save Women's College Hospital, which I is phenomenal. Which she saw as the future of health and healthcare. As Minister of State for Public Health in Paul Martin's cabinet, she established the Public Health Agency of Canada and appointed the first Chief Public Health Officer for Canada. The Minister believes good public policy comes from, I love this line in particular because I believe this as well, but the Minister believes good public policy comes from listening to those with expertise and those who have lived experience. And she is, and you will love what the lived experience being shared is today. She's also co-author of Kill or Cure, How Canadians Can Remake Their Healthcare System, and passionately, as many of us know, works to recruit and support women to elected office. So welcome, we're so happy you could So Minister, we're talking about youth and mental health. We're using this mental health week to bring awareness to the impacts that the pandemic has had on all of us from a mental health perspective, but especially on youth and youth who are facing other barriers. I'm wondering if we could just start by having you speak a little bit about, certainly, you come at this from so many different experiences, but what you're seeing in terms of youth mental health and how the government is addressing those challenges, especially around the pandemic.
No, it's really it's an honor to be here and in such a great group that really are here to have a conversation about these things where we know we have to listen in order to get this right, and that it really is everybody who cares about this. I think that as we always do the land acknowledgement and knowing that we're here on the unceded territory of the Anishinaabe and Algonquin people, that we have to acknowledge that maybe if we'd listened to them, we would have got this right. In not only in climate change and listening to women and youth and children and elders instead of elderly. There were a lot of lessons that we sort of ignored. But one is the medicine wheel and how that to actually keep people well, physically, mentally, emotionally, and spiritually, and to be able to find that balance is really what we're trying in life. And what I think that we learned certainly from my time doing, a decade almost learning from First Nations, Inuit, and Métis is that it is about a secure personal cultural identity. It is about being proud of who you are. That's your resilience. That's your sense of control over your life. It's your confidence and self-esteem. And so that for us to really, we know that doesn't happen at the suicide line. That this is a life experience with all of those supports and wraparound services that can happen really from the earliest possible day. So today's, as you know, World Maternal Health Day, and I meant to say, I think some people think that's the only way I've been able to get elected this many times. I did deliver about 2,000 babies that can all now vote. So there is, and I think that also when you get to attend births and then watch people grow up, you have a slightly different view of youth, of children and youth. I think as a family doctor, I had the privilege and honor of looking after some of the kids from Youthdale. I then watched when some of them became the leaders and the social workers at Youthdale. And so that when you know that there are things that can happen that allow people to really understand their talents and understand how they can help. And I think what we're hearing even from the Kids Help Phone or from so many places, people who have volunteered doing things, and whether that's even a camp counselor, that they can apply those skills and then want to be involved in science or all of the health professions that, who was it? It was Dr. Kuchar last night who talked about that he had a degree, a master's in history before he went to Mac for medical school. It was a little hard not knowing the science, right? And so I think that what you're all doing is knowing that what's happened, that all of a sudden people think that they don't do science, when I don't know of a kindergarten kid, and certainly me in kindergarten, where I kept, what's the most important question kids ask? Why? Why is it like this? Why does it have to be like this? And quite often it's, whether it's gravity or whether it's the elements, this is we can't extinguish that inquisitiveness about science and how things work. I think that's why I think it's so exciting what you're doing here.
You went from very young kids, which I think is that message that you said, no kindergarten, there's no kindergarten kid, there's no 5-year-old who isn't interested in science, for example. And that there's no issue there. It's not that kids aren't generally interested. But the problem now through the pandemic that we're seeing and talking to parents across the country and seeing the kids themselves is that they have lost that. That has been impacted. Their confidence to explore, their confidence to take risks, their confidence to be curious has been very much impacted by what's happened through the pandemic. And so I think you make such a good point that that's a natural jumping point that we all relied upon. That is now not, that it's not there. The impacts of that individually are significant in terms of a youth not being confident leads to every other decision that they make in the future. But that has massive implications for the future social and economic well-being of our country. So I love that you started there and went all the way to the post-secondary system, which is, I want to hear more from Alexandra about what you're doing in terms of that older youth component. I just want to shift a little bit though. I want to come back to you, Dave.
Yeah.
Dave and I had a great conversation, and I know a lot of you here, and the question I get most, and the question I've had most through the pandemic is around online presence and kids online, and how does that help or harm what's been going on during pandemic? We know from the research that the research out of Western said that kids went from 2.5 hours online a day to 5.8 hours. I don't know whose kids only on now. Line from 5.8 hours. I'm like 5.8. I'm like try 15.9.
Yeah.
Like when are they not online? So it's definitely an issue. And what we also know is that all of our partners who are in the space of online safety and protecting kids online have reported drastic increases in online incidents of cyberbullying and victimization and radicalization to violence, for example. So can you talk? We talked a little bit about this. I'm going to ask a double question. I'd love to hear your perspective on how you have seen that reflected in some of those awful numbers that you talked about with mental health increases. And then Alexandra, maybe on the opposite side, I'd love to hear how you think social media and online presence has actually helped, or how youth have used that to their advantage through this period. So maybe Dave, start.
Sure. What I learned myself in what I'm hearing from all of our clinicians in working the day-to-day with children, youth, and their families is what's not actually being recognized is parents and others will state that kids are spending too much time online and too much time on social media. But the lack of insight into the modeling that parents themselves are doing and the amount of time that they're spending.
What do you mean by that?
Yeah, exactly. And I am guilty, so I get it. But it's just, it's really, it's quite striking in that the modeling that, and why has that happened in particular over the pandemic is that people, that the whole remote work and working from home, no longer are you at work and in the office and you don't see your child, but now your office is everywhere in your home. It's your kitchen, it's your bedroom, it's your living room. So people are feeling very connected and the kids are modeling after, if it's okay for you, it's okay for me. So what we're seeing is the amount of time the kids are spending on the phone, the detrimental effects that are that of just having that total disconnection of having the actual social face-to-face contact or the need for it. The amount of how you measure your self-worth on the amount of likes that you get on a certain picture, those types of things, the detriment around getting more sleep and it interrupting with your sleep, everything that you've mentioned around the cyberbullying and whatnot. But the sleep part is such an issue, and I don't
Directly for mental health, you mean?
Directly for mental health. I would say physical health and mental health is the lack of sleep because of how late they are and staying in past the night where you don't know, you think they're in bed, they're not on their phones. A lot of them are on their phones. And what we've been encouraging families and working with families to do is model yourself to be able to actually take the time to have planned disconnected time, monitor your kids' social media accounts as much as possible, knowing Snapchat sort of disappears in a few seconds or whatnot. But and just simply to be able to teach, which Alexandra would talk more around the safe usage and what's appropriate and what's not. It's been a significant challenge.
Yeah, social media and internet in general, I will caveat everything that I'm about to say by the fact that, it is really, really detrimental. It can help, it can hinder our self-worth, our self-esteem, everything. But I think the key to it all is to, as you were saying, modeling, but also to teach youth how to engage with social media and how to engage with internet more broadly. At jack.org, we have workshops on, follow, unfollow, how we can actually look at our social media usage and how we can pull back on that, how, the things that we are seeing daily are really influencing us all the time, even when we're not looking at things directly. But having said that, social media can have a lot of benefits and a lot of positives, especially when it comes to connection, advocacy, and services more generally, I think, as well. I just moved to a new city, and normally when you do that, you can't continue seeing a therapist, but my therapist is in my computer right now. It's fabulous. She comes with me everywhere. God help her sometimes, I think. But at the same time, social media advocacy and helping youth become aware of these social issues that are happening around them. I was not aware of half of what they know. Of course, there also comes with that consequences of credibility and still being attacked potentially online, all negative consequences. And then also being connected to youth and being connected to each other. I think the latest stat that we had in our research that we conducted was that 16% of youth are still going to carry on with doing video calls and staying in touch with their family and friends. We have newcomers now who are able to keep in touch with their families back home, and it's remarkable that we're able to see things like that, and that's things that can really help with your mental health. So positives, negatives, yes, but I think it really does come down to being able to teach youth, but also having youth involved in what we're creating at the same time.
Why do people care about what people think when you don't like anything else they've ever said in life, but we care about what they say about us.
Right.
Like I used to try and teach patients how to just think of this person with a turkey head on their shoulders. I just, it seems
Yeah.
weird that we actually care about what these people think.
Yeah.
I mean, I think that is a difficult lesson as an adult. Like I still I often say things to my kids and I think like,
yeah,
do I ascribe to that? And I think when they are so bombarded with, and what their defenses are low because of what they're seeing every day. Whether it's COVID related, but it's also the war, it's protests, it's wildfires, it's all the things that the graphic images that they're constantly bombarded with the messaging of like, you're not enough. And I think now because they just, you ratchet up the time that they're seeing that messaging, how do we kind of like come off on the other side? So what are the things that we're going to need to do to rebuild that confidence? I mean, you talked about the relationship with social media. They're like, Minister, you're talking about the kinds of messages they need to hear about, which are standard. That's pre-pandemic, right? Why do you care what people think who you don't respect? Like all those things are necessary. What are the top things that you think are needed in terms of either resourcing or messaging out to youth to build back confidence? And I'll get each of you to understand. Maybe you can talk about what the government is doing as well. But do you want to start, Alex?
Yeah, I think it's a hard question to ask because, like you said, I look at social media, and as much as I want to say I don't care what anybody thinks, then you see something like, I'm a fan of the Met Gala. So of course last night the Met Gala, or what's today, Wednesday? So Monday night the Met Gala was on, and you hear Kim Kardashian, I needed to lose 16 pounds in order to fit into a dress.
In 3 weeks.
In 3 weeks. Yeah, like that is the worst type of messaging that young people can be seeing and hearing right now, especially when they are already in this vulnerable state of not having confidence, not being around their peers all the time. And I mean,
and that is a message that goes directly to the heart of every single, and I'll say girls, but I know it's girls and boys. Like my 13-year-old said, what do you think she ate every day?
Yeah.
Like, can you
Right.
can we Google?
Right.
Like, I bet, like, the number of girls that would have Googled, what did she eat every day to lose 16 pounds in 3 weeks? That is a message that got heard all over the world, that message.
Yeah. Yeah.
And then you talk about, at Cheo, the rapid increase in eating disorders.
Yeah.
The hospital's reporting a 90% increase in eating disorders.
It's so hard, and I think that it's potentially $1 million question to figure out exactly
Yeah.
what is the key to stop this messaging, and I think a lot of it is making sure that youth are constantly critical of what they're
Yes.
seeing and teaching them to become critical, to continue asking those questions. As you said, you start out asking why? Well, why does that stop, and where does it stop, and how can we ensure that that's going to continue on throughout the rest of a young person's life? I think a lot of it is education as well, and to make sure that these things are also being embedded into our education
Yes.
curriculum, to make sure that, that this front line of what youth are hearing is not just from parents, but also coming from teachers, and to also make sure that we're educating other peers as well. Like, when you're young, you're not going to always go to a teacher, to your parent, and say, I'm struggling with this. That's the last person that sometimes you're going to go to. As much as we hate to hear that, you're going to your peers first. So that peer-to-peer education, that peer-to-peer understanding, having the correct information and being able to disseminate that is really critical as well.
Yeah, I agree. I don't think there's any magical answer. If it was, we'd certainly appreciate hearing it. But if you think about how it is approached, it's usually approached because now it's become a problem. So
Right.
if it's a problem, then it's your parents, your caregivers, your teacher that are approaching you, and you start off in an adversarial relationship around addressing what it is, as opposed to really switching that to a proactive means of just talking about it. Like, tell me about what do you want, what do you use, what do you look at, and just try and understand it better from their perspective, so that you start engaging in in a proactive relationship that starts talking about the healthy use of it and really understanding it, as opposed to it's a problem. Now we're starting off, which you're just frankly you're not going to get anywhere.
I think that part of it is teaching critical appraisal. I think that, you know, I had that little TV show once. The first 10 minutes of every show, we looked at what was in the paper that day, and we looked at studies and said how many people were in the study, who paid for the study. You know, how do you teach critical appraisal that should be part of creating citizens? And I just think that, and then the EQ part. So if you've got the science side and then the EQ part, I mean, we all trained, you know, I was an examiner for the College of Family Physicians. The easiest way you could get full marks on rapport was to say, you look happy, you look sad, you look worried, you look whatever. If you can comment on somebody's affect, you actually immediately have connected with that person.
Noted. And I mean, I think that is the issue, is that so much of this is so formative, and that's why it's the work that the Jack.org is doing. Of course, the work at Cheo is so critical to us kind of providing not only the kind of thick skin for kids, but also like let's talk to the kids who are doing the damage as well. And I mean, there's a reason, and I love that you said that. Like they're, you know, it's something that we try to talk to kids about too. Like they're mean. They're often when they're acting like that, it's because they've been hurt and they've been damaged. And let's, you know, like try to have some empathy there as well. And these are life skills, and we connect them now to say, not only is it a life skill, it's a skill at work. So this is a future of work issue where dealing, you know, how to deal with stress, how to have empathy. Those are going to be as important in the future of work as the technology skills that we're also teaching kids. And thank you for your time and being here and sharing the stories and the experiences, and we really appreciate it. And thank you all for coming, and we're happy to have you here. So have some more food, have some more drinks. Thanks.